We're going to talk today about some of our concerns about what we're seeing as the potential downfall of functional medicine. I'm Dr. Martin Rutherford. I am a certified functional medicine practitioner, and I am a chiropractor also since 1979.
I'm Dr. Randall Gates. I'm a board certified chiropractic neurologist as well as being a chiropractor.
In our practice, we have married two functional disciplines to ultimately, inadvertently develop a chronic pain, chronic condition practice. Our particular practice has a heavy bent towards neurological problems, but in essence, if you've heard of just about anything out there that can be treated with the exception of cancer, we probably treat it with a functional medicine approach. I do the vast majority of intakes. We do intake interviews for our functional medicine practice because we're working with the patient's physiology. We're working with their belief systems, their paradigms, and we try to be as certain as we can that that patient is a good fit for what we do. And if we can accomplish those and accept the patients who are the best fit, we get a consistently successful result in pretty much anything that we treat. And we follow pretty much classic functional medicine and functional chiropractic neurological principles that were taught by the founders and of these professions. And in doing these consults, I've gone through kind of phases where in the beginning, when I was doing this years and years and years ago, nobody knew what functional medicine was, and I was getting attacked. And how do you know this? You're a chiropractor. What do you know? And when my doctor doesn't know this, and he says, I talked to my doctor about it, and he says you're crazy. That was like my first years. And then after that, it was, I found someone who went to a functional medicine practitioner, and they got better. And then it was, oh, Dr. Oz told everybody that he goes to Dr. Hyman. Dr. Hyman's a functional medicine doctor. Now, we were inundated with functional medicine practitioners for like 2 years after that. Functional medicine patients looking for functional medicine practitioners. And at that time, there was a very clear paradigm of what functional medicine was all about, even though it was still evolving. And we're going to talk about that. There was a very clear paradigm. People were coming in, they kind of understood what we were going to do, because they had been, there was a clear paradigm. Since then, functional medicine has grown substantially. I still have many people coming in looking for a functional medicine doctor, but they will have been other places and to other functional medicine doctors, except what I'm seeing is they're here because what was being done in these other offices, and we're going to talk about them, is not what we would call functional medicine. And I have a concern that functional medicine could have a problem with this, because I'm starting to see patients, well, I went to a couple of functional medicine doctors that didn't work, but somebody told me that you guys do it differently than that, and maybe I should come over here and just interview with you and see what you're doing. What we're doing is what we were taught, and what we're doing works. And it works because we're doing what we were taught in the full breadth of it, and we're starting to see a dilution of what functional medicine is, and it concerns me, because I think that it could start to create a confusion as to what a functional medicine doctor really is and what their paradigm is supposed to be. And I think it can start having people maybe not have the confidence in it that they should have if they do happen to engage the services of a classic functional medicine doctor who had the understanding of the full breadth of the paradigm. And so I think it's important. I hope I'm not rambling on here. This is something that's really, really been bothering me for about the last 6 to 12 weeks, because I'm starting to see the patient that I just described come in the door. And I had a classic example yesterday of a wonderful lady, and just a wonderful lady. And she had done her research, but she essentially, what I'm seeing now is that in alternative medicine, there are factions in chronic pain. All right, we treat chronic pain. There are factions that are developing. There's still the medical faction, and the medical faction is you come to us, you have chronic pain, we give you medication for it, you go to pain management, we do a surgery. If that doesn't work, we do more pain management. That's the medical model for it. Then there's the medical model of the medical doctor, which we're going to talk about a little bit. And we're not saying that these are bad people, okay? But the medical doctor, many of whom say, I'm tired of not getting my patients better, I want to go to alternative medicine. Or they might say, my practice isn't doing very well because of Obamacare and because of this care and because of that care, because I can't get on private insurances, because of HMOs and all that type of stuff. So I want to do something else where I can make a really good living. There's that group, okay? But they're still using the medical paradigm of, here's a symptom, take a pill, whether it's an herb or whether it's a pill or whether it's integrated, whether it's integrated. And we're going to talk about the term integrated. And then you have the functional medicine group that is not supposed to be a mirror of those two paradigms. And yet what we're seeing is we're seeing many, many, many different forms of concepts coming into our office of what functional medicine is from patients' experiences of going to other functional medicine doctors. It's kind of like chiropractic. I hate to say that, but we're chiropractors, and you can go to 150 different chiropractors and there'll be 150 different techniques. And I have to be very careful if a chiropractor comes up here to Reno from Southern California. I try to find out what their chiropractor was doing, if that patient was satisfied with it. To try to duplicate what that person's doing, you have to know their techniques. There's 186 different techniques. And it's hurt us. It's hurt us as chiropractors. If you're watching this and you know anything about chiropractors, you're either thinking, oh, you chiropractors are crazy already because you got that idea from it. Or you'll say, well, yeah, well, my chiropractor doesn't crack my back. And you do, kind of in a derogatory way. I've gotten that. Or you don't crack my back, man, my chiropractor. I mean, it's like, this is my concern of what is going to happen to functional medicine. Not with that sweet lady yesterday. She had a case we could help, no question about it. Not even for us, not even going to be a difficult case. But she had so many concepts of what the different functional medicine doctors that she had gone to were, that I really just had to politely, as best I could, say, let me tell you what, looking at your history, what I see from a classic functional medicine approach. And she had like 12 different thoughts in her mind of what was going on. She had like 2 things wrong that were causing all of those 12 things. That's the core of functional medicine, is finding out truly, for a change, finding out what the true cause of the problem is. One of the things that this patient said was, I have a B12 deficiency. I said, did you get tested for it? She said, no. I said, well, I had somebody do a hair analysis and tell me I had a B12 deficiency. She had like 12 things like this. And I said, okay, well, let's just say you do have a B12 deficiency. We need to know why. And she's kind of like, well, I'm taking B12. I said, do you feel better? She said, no. I said, well, maybe you don't have a B12 deficiency, or maybe you need to find out if you have hydrochloric acid problems in your stomach to where you're not breaking down your B12, or you need to find out if you have a
MTHFR.
Or that. I talked to her about that, the MTHFR gene. Or you have to find out if you have the intrinsic factor, pernicious anemia. Or you have to find out if you have like a leaky gut or celiac or something along those lines that are not allowing you to absorb it, and on and on and on. So this is functional medicine. Okay, we want to bring people to the understanding that when your body starts working well, you start getting better. Really, that's the bottom line. And what I'm seeing is too much. One person's treating this, one person's treating diabetes, one person's treating cardiovascular, one person's treating food allergies. Fine, whatever. But that's not the paradigm that functional medicine was meant to put forward. So let's talk about how functional medicine started, and let's talk about.
I would say really functional medicine started with the naturopaths. Naturopaths, way back when, they were addressing systemic diseases with nutrition, with vitamin supplementation, all well and good, but they had to gonna figure out how to help someone if they didn't have a medication in their arsenal in terms of therapies that they could give to someone, or they couldn't do surgery. And from there, I would say a lot of chiropractors kind of jumped on that bandwagon. Chiropractors got very into nutrition, even as early as the 70s, possibly
Yeah, I was
even
doing
before
it
that.
in the early 80s.
Yeah. I know even the founder of chiropractic was talking about nutrition back in the early 1900s. And acupuncturists have evolved what they're doing to incorporate more and more nutrition. That's been my observation.
And acupuncturists classically are taught herbology.
Right, exactly.
Doctors of osteopathic medicine are classically taught diet, herbs.
Mhm.
In fact, I would argue that what we do in our office today probably closely relates to classic Chinese medicine, of which acupuncture is just like 1/8 of it.
Right, right. So that's really where functional medicine kind of got its start. And the next point I have down is, why is functional medicine so popular to doctors? And really what we've observed is that doctors more and more have acknowledged that the solutions for chronic pain just aren't there. We have a chronic pain epidemic in this country. Dr. Rutherford and I talk about it all the time. Somewhere between 100 to 120 million Americans have chronic pain. That's almost half the adults in this country. It's just astounding in terms of the epidemic of pain in this society. Our standard pain management approach includes taking medications. Lots of times people in chronic pain end up on opiate medications that are hard to get off of. They're addicting. We have this whole regulatory issue now of drugs like hydrocodone and Percocet, because people can sell them on the street to make a lot of money. So with all that, not to go off on a tangent, is that we have a model for chronic pain that just is failing. And even Time Magazine came out in 2011. The head of the Harvard Medical School said that, we feel that we're failing for chronic pain patients. So a lot of doctors have stepped back and said, well, I hear these great results about going on a gluten-free diet, or I had this patient who went on vitamin supplementation, all of a sudden their fibromyalgia went away. So more and more doctors have started to investigate this field of nutritional medicine, or also known as functional medicine. And it is gaining in popularity. It's evolving rather quickly. And with that, it's going in 1,000 different directions.
Because it's not regulated.
At the speed of light, because it's not regulated. So that's kind of the point I wanted to make.
And I'm not a big regulation guy, I thought. But it is going in 1,000 different directions because there is no regulation to it. But the people, so I understand, those of you who haven't watched, I got into this because I got pneumonia. Next thing you know, I put on weight, my hair started going away, my energy went out, I got pain all over the place. I ended up with 2 functional doctors. One was a functional chiropractic neurologist in Appleton, Wisconsin, who taught me a tremendous amount about the nervous system, chronic pain. And then the other he referred me to was Dr. Datis Karazian, who I want to give full credit for, because I believe that he was the one who really formulated the paradigm that jettisoned functional medicine. In my opinion, without him, there's no functional medicine. It goes nowhere. That's my opinion. I was there when it started. I was there when he started teaching it. I was there when he was talking about autoimmune problems when everybody thought it was a joke. I was there when he was talking about Hashimoto's when nobody even knew what it was. And these are big core factors if you're going to be treating people functionally. He built off of a gentleman named Dr. Harry Eidner. Is he a doctor, PhD?
I believe so, yes.
Okay. Harry's, I think he's a biochemist with Biotics today, who did a 10,000 patient study, 10,000 patient study over a period of 10 years. And he is the one who came up with the functional norms. Any of you who have heard anybody say, oh, I know the numbers are all off today and they're not right, that's where it came from. Dr. Datis Karazian took those and he made it into a very organized, formulated idea. There were people who had come up with the term functional medicine before that, but it was a non-congealed type of situation. It was do diet, do exercise, eat right, and so on and so forth. Take pills. Jeffrey Bland, I think he started it. Didn't he write the formulas for, is it Standard Process that he wrote them for? Or it was one of the companies he was heavily involved with. But I think he was the first person to term functional medicine. So there's a history here of functional medicine, and there's a very organized evolution of it. And it's and what I'm starting to see is that because it's not regulated, because anybody can say they practice functional medicine. In this state, as a chiropractor, you can't say you practice functional medicine unless you have 120 hours under your belt, at least. Okay, I think that's minimal, but you can't. But I think there's only 3 of us in the state that are allowed as chiropractors to call ourselves functional medicine doctors. It's literally, you know, against the law to do that. The board will show up on your office if they see you saying that. But other professions don't have that parameter. So we're starting to see functional medicine morph into lots and lots and lots of bits and pieces, kind of like the example you use in your part of our talk, kind of like dandelion
flowers blowing in the breeze.
Blowing in the breeze.
Yeah.
We have so many of these different pieces coming from the core that are defining what functional medicine is. And what I'm starting to see is I'm starting to see a little bit of doubt in people's minds now about it when they're coming in, because they've tried it, it didn't work, or it was only a bit, or it worked for a while, they got on this diet, it worked for a while, it didn't work. And we don't have that here. There's a very, very, very organized way of approaching a case with a functional medicine paradigm or a functional medicine logarithm. Is that the evolution of,
Yeah, and I would say, kind of as we were discussing before, I really feel, and you iterated this, but I'll reiterate it, that Dr. Karazian really brought everything together.
Yeah.
And he really emphasized the importance of the immune system. He brought in some major players in the field of immunology to start testing patients who have been told that they're normal for these kind of subclinical autoimmune problems. And now, 7 years later, we have some fantastic autoimmune panels that we can run and really verify to patients you do have something wrong. Because so commonly patients consulting functional medicine doctors are in the gray area of medicine. Maybe they have a subclinical hypothyroidism, so they have a borderline thyroid problem, or they have chronic fatigue, or they have IBS, where they don't have cancer in their bowel, but they have all the symptoms of somebody who has cancer in their bowel, and they're suffering long-term with these things. And so from Dr. Karazian's organized approach in how to assess someone, we've developed these immune protocols, and that has really helped the functional medicine world. But as you were saying...
But that was what the functional medicine world was put together for.
Right. And so now, because of its popularity, now functional medicine is being taught at different medical schools. Now there are major anti-aging groups that are promoting functional medicine.
Supplement companies. Right?
Supplement companies promoting functional medicine. Now it's the cool thing almost. It really is the cool thing for medical doctors, for everybody to be jumping into this area of functional medicine and nutritional medicine. But that's diluting it. And for a patient's purpose, you don't know what you're going to get, kind of like a box of chocolates when you go see a functional medicine practitioner. Very similar to, a lot of patients have to see 10 different chiropractors before they find the right chiropractor for what they're looking for.
But to me, the point is that these gentlemen developed functional medicine, and I think it was ultimately developed to handle what? We went to a whole seminar a couple of years ago on diet and inflammation and chronic conditions. It was designed to put together chronic conditions. So a person comes in here with chronic fatigue, okay? And so you're going to be looking, if you come to us and you sound profoundly fatigued, I'll tell you, here's what we're going to be looking for. We're going to be looking for an undiagnosed or misdiagnosed or mismanaged thyroid. We're going to be looking for a blood sugar situation in which you either have prediabetes and diabetes, and you've either been told you don't need to deal with it if it's prediabetes, or you're dealing with it and you're diabetic type 2 and it's not working. We're going to be looking at your stress mechanisms. We're going to be specifically looking to see if you're in some sort of a post-traumatic stress syndrome, either major or minor, or we're going to be looking at what our stresses might be on your adrenal glands, and we're going to be looking at your gut and the myriad of things that can be doing that. That's chronic fatigue. But what's happening is people are dividing the profession into, I'll do your diabetes type 2. I'll do your gut. I'll just do your thyroid. I'm going to specialize in thyroid. Well, here's the problem. The whole point of functional medicine is you have one body and it all works together. And if you only handle the one aspect of, if you have a blood sugar problem and it's not coming down, and you're dieting, and you're taking, and you're jogging, or you're running, or you're walking, or you're going to the gym, you're still taking a blood pressure, you're still taking a blood sugar medication or two, and you're ecstatic because your numbers are still in the pre-diabetes range, there are other things going on. And there will have to be other things going on that have to be addressed. And it might be an abnormal bacteria in your gut. It might be a thyroid that's not working properly. It might be a stress. There's a number of things that are causing it. This is functional medicine. This is the unbelievable beauty of functional medicine. I can't even tell you how amazingly cool it is to be able to practice this way and understand it. But what we're seeing is that it's getting broken into pieces. And I'm just concerned about it. I'm just concerned about it because we've been chiropractors forever. I mean, I can't tell you how effective chiropractic can be in a properly selected patient. Yet I see estimates that we see 8 or 10 or 12 or 11% of the population. There's still a lot of people out there that think chiropractors are quacks. Chiropractors get a really good education, really, really comprehensive education. And they get nutrition, and they get tons of diagnoses, and they get a ton of things going on. And one of the reasons that you see chiropractors go primarily to manipulation is because that's what the insurance covers in a chiropractic office. They don't cover nutritional counseling, even though we're capable of doing nutritional counseling. We're taught more nutritional data than all of the other medical professions put together. In our particular profession, but insurance doesn't cover it, so then the chiropractor doesn't want to do it because insurance doesn't cover it, or they do it and then they charge Medicare for it, which is not legal, by the way, and it just creates all kinds of problems for chiropractic. I think functional medicine is the answer for chronic pain. We do work with other doctors, okay, but the major core of what we do in 75% of our cases is this functional medicine paradigm that has been developed by these men, and that was promoted in the beginning and that was practiced in the beginning. But I do think that maybe it's losing its identity. Mm-hmm. And I mean, far be it from me to say, if I were a chiropractor, I'd say, well, this is what chiropractic is because this is what the originators of chiropractic thought it should be. And then a lot of people have taken it in a bunch of different directions. And chiropractic really has a foggy identity. It means different things to different people, and it has hurt us. I have experienced that. I've been in chiropractic technically since 1975 when I got into school. Mm-hmm. Okay. And I've watched it. I've experienced it on every level. I've been involved in the legislature. I've been involved as the president and vice president of state associations, local associations. And I'm just getting that same feel that we might lose this.
I agree. I mean, you look at dentistry. Dentistry is an allied health profession. Dentists have had a very focused direction that they've gone since the infancy of their profession. They were not within medicine, but they excelled in taking care of the mouth, and now they're the well-established experts on taking care of the mouth. Functional medicine could be the same thing, and I would categorize functional neurology too into addressing chronic pain. But will functional medicine be able to sustain that? That's really the critical question. One analogy Dr. Rutherford and I were talking about before this broadcast is that there's this treatment for disc herniations in the lower back. It's called low back decompression. And it can be very, very effective for herniated discs.
A lot of people have heard about it now.
A lot of people have heard about it, and it can prevent back surgeries, which can, lots of times be unsuccessful, not all the time, nothing against the surgeons. But it's a great therapy when properly used. When I first started with Dr. Rutherford, he was still doing decompression at that point, and we ran an advertisement, and only 2 out of 15 patients that came in actually were candidates to go on the low back decompression tables. A lot of doctors, though, medical doctors, chiropractors got into using low back decompression because they can make a lot of money using it. So no matter who came in, they were going on that table. Whereas in Dr. Rutherford's situation, he wasn't putting patients on that table because they didn't have a disc problem. They had a muscular spasm. They had degenerative joint disease. They had a short leg. They needed orthotics. So you kind of get the point. And within the realm of functional medicine, there are therapies like that where doctors can make a lot of money. Things like chelation, where we take the heavy metals out of the body because heavy metal toxicity can result in autoimmune problems. But within the functional medicine algorithm, we don't address heavy metals until it's like last on the list.
If it's even involved.
Even if it's involved. We did have one case in the last 6 years that really needed chelation. And man, I would say that it helped dramatically. It saved this girl's life. But there are other practitioners out there where everybody gets chelation because they're going to make $20,000 to $30,000 on those chelation programs. So I think you kind of get the hint in terms of maybe some of the slippery slopes that are there within the functional medicine community. You know, in terms of what we need to do to go into the future to have an identity. I think regulation to a certain degree would be good. A board would be good. An oversight agency saying this is what we need to do in addressing a patient with chronic pain, chronic fatigue, these functional problems like IBS. And doctors need to kind of have that orientation of how to work a patient through that, not necessarily just so you can charge the patient the most amount of money, but how you get the patient better and keep them better long term. If we maintain those ethics, then, you know, we're not trying to be up here on the hill saying we're perfect, but there does need to be some sort of ethical value going forward for this kind of alternative profession to keep going.
Yeah, and I want to make it clear, we're not saying, and we're not saying the acupuncturist who says they're doing functional medicine is a bad person or a bad doctor, or we're not saying that the chiropractor says they do functional medicine and gives you a standard diet and supplements is a bad person or a bad doctor. We're just saying that there is a paradigm for this, and that paradigm should start off with them having a full background. There's now a 100-hour education out there, which is okay. I'm not going to say who it is. We just got this yesterday. There's a 200-hour class out there, Functional Medicine University. There's Functional Medicine Institute. There's a 50-hour master's degree up in Portland. There are organized ways. There are organized programs. I think Loma Linda University is now starting to teach a program. I don't know how organized it is, but I know it's only for medical doctors. And Harvard's teaching a 24-hour program, which I can tell you cannot be enough to learn functional medicine. But the point being that a functional medicine doctor first is taught how to take a history. If that history says you don't need chelation, you don't need chelation. If that history says you don't need to be checked for the MTHFR gene, you don't need to be checked for it. Yeah, we have people coming in here now saying, my folks went to a functional medicine doctor and he told me that you need to check them for the MTHFR gene. And it's like, well, we'll know once we've done a history. Did they do a history on it? Well, they talked to them for a couple of minutes. Did they do an exam? All of these organized disciplines that are being taught in higher education schools are telling you to do an exam. I will say that the learning that is being taught by the vitamin companies is not telling people to do an exam. Okay. So this is a very precise science. There should be a very thorough history based on the paradigm of chronic problems and all of the history from the time you were born, including all of the systems of your body. There should be a thorough exam, a head to toe exam, at the very least a general systems exam. We do a general systems and a neurological exam because we have seen in chronic pain, and this is acknowledged in those courses, that chronic stress and chronic autoimmune problems seem to be the two main underlying problems that perpetuate these chronic problems. You need to have an exam that addresses that. Our exam is an hour and a half. I noticed in here that they are going to teach an exam, and it's called a rapid comprehensive physical exam protocol. Why? Because people don't want to spend a lot of time with you. I'm going to go back and pat Dr. Karazian on the back. When I started taking his courses and I was working with him, he said to people, do not do this. If you are not willing to sit down, look at people's records, get their records, there will be answers in those records. Then you need to take the time to do a thorough history and a thorough exam. You're going to have to build that time into your practice. If you don't do that, you are going to fail. You are going to have a lot of failed cases, and you're going to get frustrated, and you're not going to do this. And so that's what's being taught in these organized protocols. That's what the original model of functional medicine is. And we're seeing it dilute. And I understand, I've been in these classes. I understand that an acupuncturist has a background and maybe they're just looking bits and pieces to add to what they're doing. And I understand that a chiropractor maybe just wants to do diabetes, and they're trying to take bits and pieces and they put people on a diet, and maybe some people get really better and some people don't. But that's not functional medicine. But people are allowed to call themselves functional medicine practitioners because there's no regulation against it. And ultimately, I feel that is creating a confusion. It's not going to, that approach is not going to achieve the consistently successful results that the classic functional medicine practitioners tend to get. And I'm just feeling it. I'm just feeling it in the last couple of months. I'm feeling it in the consults that are coming in. I'm having to kind of redefine for them how we need to go about their case. Whereas, I mean, like, frankly, our best patients just come in. They don't know anything about anything. They just know we help somebody. Somebody sent them in. We tell them what we're going to do. They go do it. We do it, and it works, you know. But that's getting less. The internet's out there. Functional medicine has a name. Functional medicine is now functional. But think about it. If you're watching this, you really don't have an idea what functional medicine is in your head. You just know it's not medicine. And you just know it maybe helps somebody, maybe helps somebody a lot. And now you're looking up a functional medicine doctor. There's no advertising laws. Anybody could do it. Again, I'm not saying these people are bad people. I'm not saying they're bad doctors or chiropractors. I'm not saying they don't know what they're doing. But they're bringing their paradigm, their medical paradigm, to the functional medicine world. And it's going to be, I'm going to give you a shot. I'm going to give you a chelation. I'm going to give you this. I'm not saying they're bad. I'm just saying that's not the best model for a chronic pain condition if you want to get it under control and you want to give the person the tools to keep it under control. Okay. And so that's what this profession was put together for. And I don't know. We've just been talking about this for a couple of days. So I don't know. We just thought we'd get it off our chest. This may be something that nobody watches ever again. It may be something that's important to certain people. We're not here to upset other people who are practicing functional medicine, who may not even be aware that functional medicine is an organized discipline. I mean, an acupuncturist can argue, and I'm pro acupuncture, by the way, don't get me wrong, okay? But they can say, well, I'm doing acupuncture, I'm giving herbs, I'm changing function, I'm practicing functional medicine. Why wouldn't you say that? You know, because there's no organized discipline. But I hope you understand a little bit better what you should be looking for in a functional medicine practitioner. And if you have gone to a functional medicine practitioner and it hasn't worked, okay, or you got part of the way, and I have a patient sitting here right now. She went to someone for a thyroid. Person specialized in thyroid, put her on a gluten-free diet, gave her a zillion supplements. She lost a ton of weight. She feels much better. I can tell you the whole reason she got better. She went there for a year. I won't even tell you how much it cost. It cost more than what we charge. And basically that gluten-free diet is what got her to this place. Okay. But now we're gonna be able to get her to this place and this place and this place and this place, because that's where she wanted to go. And she ultimately quit going to that doctor because that's what she told was going to happen, and it didn't get there. She was taking a lot of supplements. You go to a functional medicine doctor and they're not doing a full exam on you, they probably haven't gone through one of those courses. If you go to the functional medicine doctor and they're using one diet, the Mediterranean diet or paleo diet with you, they probably didn't go to any of those courses. If you're going to one of those folks and you're walking out with bags of supplements, they probably didn't go to one of those courses. If you're going to one of those folks and they go, oh no, medicine's bad, don't ever talk to medical doctors, that's not true. We have to engage the medical community. As I think I said in the beginning, as much as maybe 25% of the time on certain issues, because sometimes by the time the patient gets to us, their physiology is not recoverable completely. So as for me, I probably have Hashimoto's for like 27 years or more, until Dr. Karazian was the one who kind of figured it out. And he wasn't he was the one who figured it out. And I did all the right things. Everything got better. My hair came back, my weight went, but I still had profound fatigue. We finally said, okay, we'll do the thyroid medication. Boom. Here I am blabbing away at 1,000,000 miles an hour because my energy levels are good. So that really was the paradigm, I was taught. It was the paradigm that was meant to be. And for a variety of reasons, which you may be able to glean from even in between the lines of some of the things that we said, it's kind of losing its identity. And I've seen it hurt chiropractic, and I'm concerned that it's going to hurt functional medicine. So I'm appealing not just to patients, but I'm also appealing to doctors who might be out there doing this in different segments to maybe look into Functional Medicine University. I have no affiliation with them financially or anything like that. Look into Functional Medicine Institute. Look into Dr. Vasquez's master degree program up in Portland, Oregon at I think it's the Chiropractic College, Western States Chiropractic College. And there's other developing ones that you have to be a doctor to qualify for, certain doctors and stuff like that. But I would strongly encourage you to do that. I think it would be good for you. I know it would be good for all of us. And I don't know if this was just a babble. I don't know if this was just a blow off. I don't know what it was, but it's something I am really concerned about. I think that this profession has the potential to change the course of chronic disease. I know it does. We see it every day, but I'm concerned it's going to get diluted to the point where it has no identity. People don't know what it means. They don't know what they're walking into when they walk into a functional medicine doctor. They don't know that they can't call somebody online, get a 3-page history, have them do a 10-minute history over the exam, charge them $9,000, send them 2 bags of supplements, and expect to get better. And that is one model that's out there. Okay. Right. So anyway, so for those of you that needed to hear that, I hope that's helpful. For those of you who didn't like it, I apologize. I'm just telling you, this is what I'm seeing, and I'm trying to speak in the best interests of everybody involved, because I have all those diseases. I'm better. I want you to be better, and I want you to know that there is a solution out there. And if the solution doesn't look something like what we're talking about, then there may still be a solution out there for you, and it may still be called functional medicine.
Nice. That was great.
Okay.
All right. Let's wrap it up.
All right. Wrap up. We'll see you next week.
Okay. Thanks for watching.